Can a disc herniation heal? A disc herniation is nothing but the leak of the nuclear material outside the annular rim, and that encroaches the space in the spinal canal that can cause mechanical compression of the nerve. Additionally, it can cause severe inflammation in that area that produces both mechanical as well as inflammatory pain. This disc herniation is not an overnight process. The disc herniation will be beginning as a disc degeneration. A degeneration is nothing but a dehydration of the disc material, which you can see in the MRI, especially in T2 weighted MRI. You can see such degenerated disc as a hypointense or darkly appearing disc compared to a healthy disc, which is bright hyperintense signals in the T2 weighted image. It nearly takes around 10 to 15 years for the degeneration to happen. Till then, the patient will not have any idea of that. Once the degenerated disc will become a bulging disc, maybe the first few symptoms will begin. As years pass by, it can lead to herniation, and such herniation is the final outcome of the degenerated disc. It will attract vascular granulation tissue. It becomes pretty big after it herniates out, and that causes severe compression of the nerves in the canal. When someone says that they can push the disc inside back to the original place, they are technically inaccurate. Once the nucleus of the disc is out, no one can put it inside. It's something like paste. When you squeeze the paste, when it comes out, you cannot put the paste back to the packet because it's one-way traffic. Similarly, when the disc is outside, you cannot retract it back and put it back to normal. It will never happen in the normal physiology. But how some people are improving over a period of time? It is because the size of the herniation may shrink. We call it as an autophagy, where the immune cells will go and attack the nucleus pulposus, which is outside its boundary. The body will think it as a foreign body, and then it will try to digest it. So the size will perhaps shrink. Sometimes it will shrink nearly 70-80%. There's a subtype of herniation called sequestration, where the part of the disc material is completely cut off from the mother disc. In such cases, one can expect reabsorption or disintegration of the extruded material. One can expect a good amount of improvement in a sequestrated disc compared to the herniated disc. But again, there are so many variations in that. It depends upon the type of the bulge, the severity of the bulge, and the age of the patient, the inflammatory tendency of the individual, the genetic makeup, the pain tolerance, neural circuits. That will decide who will suffer how much pain and what type of symptoms they will have. But some people improve anyway. That improvement is due to the inflammation reduction. In most patients, even though the herniation size wouldn't have reduced, even though the herniation is not anatomically healed, functionally or physiologically, the patient would have got healed. I mean, physiologically the pain would be less, but anatomically it wouldn't have healed. So maybe the size can shrink, even if it shrinks for 1 or 2 millimeter, 3 millimeter. That's what the space that is needed for the nerves to survive. Thereby the pain reduction can happen. Anatomical healing is different from physiological or functional healing. So we all are looking for functional healing.